Good morning, everybody. I'm very happy to be here on this occasion. I should thank Mr. Chakrapani and the Aravind High Hospitals for having invited me. I think this workshop on innovations or excellence in eye care comes at a very opportune time. As we embark on the 12th plan, as we look back, reflect on what has happened in India in the sector of eye care, and as we move forward, I think we need to bring in not only take into account not only the best practices or the good practices that have been happening everywhere, but also we need to lay the way forward for how we can take this forward. I think, as you know, statistics can be used in different ways, but anyway, let me tell you, India is home to 12 million blind people. Many of the diseases are known, and it is also said across the world that a child goes blind every 5 seconds, and another thing. But the only statistic I think which we need to remember is that 80% of these could be avoided if we have access to eye care. And that's the only one thing that we need to remember as we move forward. Because most of the blindness in India and elsewhere could be prevented by providing quality eye care to these children and to everybody else. So the Indian scenario, as we look at it, I think we have had a very well-structured program that has been in existence for the last 3 decades. It has traversed our ground, moving from trachoma, being a trachoma in the country, where we had a trachoma program, and moved on in 1976 to a program for the National Program for Control of Blindness and Prevention of Blindness. And today, as we sing in the 11th plan, I think much of what we are talking about, if you look at the presentations that Mr. Tulsiraj said, the things outlined by Mr. Nam Perumal Swami and by Mr. Chakrapani, I think 2 things come out. It's all about comprehensive eye care and quality delivery of eye services. And it's also very pertinent that this was the basic theme of the 11th plan when we set out to do it. But how far have we come, and how much further do we have to go? That's the question that we need to ask ourselves today as we stand here and as we go through these 2 days of intensive discussions, interactions, and trying to learning from each other. In the 12th plan also, that this is what the goal that we set for ourselves. And India, I think, I love saying this, we have been a very cataract-centric program. We've also concentrated on looking at refractive errors, but we somewhere along missed the other eye diseases. It's been there, it's not been reported, there's been no monitoring. But I think as Mr. Tulsiraj also spoke about the demographic transition that's happening, India is becoming home to the largest diabetic population in the world. It's also home to some of the hypertensive patients we have seen. So as we move ahead, I think other eye diseases, whether it's diabetic retinopathy, whether it's glaucoma, and on the other side, I think we are also, you said that we have the largest child under 5 population. We are home to the largest elderly population. We are also, this population is also, I think, there is, it is more than 50% of them are women, widows, and those of them who are staying in the rural areas. So when we talk about innovations, innovations are not always finance or money driven. It can be simple things. I think it was when we have this kind of a scenario, I think it's all about bringing eye care to the patients. But on the reverse, it is also bringing patients to eye care in India, because very often, even though cataract surgeries are there, there is this thing, many of the patients are not coming in and we have not been seeing. That's why there's been a very intensive awareness building to have people come to and take eye care. And the other side, I think 2 more points that become very relevant is the high quality that is needed to be provided. India boasts of a very high cataract surgical rate. These were part of some of the innovations that I think if you look through the ages, we have moved, I mean, whether for treating hypermedia or for treating nearsightedness or saying, they have been saying, today we have LASIK, we have intraocular lens, these are some of the things. But these were things about eye care, innovations that happened, excellences that thing. But there was also the systems approach that needed, and that's where probably partnering with an institution like Aravind comes important, where they have built up a system which is able to think excellent outreach programs, They've also put in they have their own labs, their own systems, they're saying. Well, like I mentioned, India has got one of the highest cataract thing, but on the other side, we have also had some of the states, even during last year, where we had mishaps in many states. This is what we would need to avoid, because we cannot afford to have those mishaps. We cannot have. And it's not that Mr. Tulsi Raj said it's not rocket science. It's no science at all. You need to pay attention to some of the details that are required, pay attention to the kind of facilities we provide, pay attention to the protocols that are required both pre-operative and post-operative. And we could have this thing. So it's not always money. It's about trying to put in place systems, trying to take it forward and to follow this out, so that while we pride ourselves on saying, we also have to pride ourselves on ensuring that not a single person who could have been provided sight lost out because some inefficiency in the system. That cannot happen. So we need to concentrate on providing quality eye care services and comprehensive eye care services. I think that's where the role of the RIOs, the medical colleges come into play, and rightfully whoever, when they decided these programs, we did put in a lot of money into infrastructure building. We put in money into trying to see. The RIOs were supposed to be the centers of excellence. They were supposed to be the centers where research and development activities. But recently when we had a review, the first of it, we realized that probably, yes, AIMS in Delhi, you have Kerala, you have, say, in it was very surprising, Gujarat had all the excellent facilities. They also send out teams to operate in Africa, and very recently also. But within their own state, within their own districts, they are looking far ahead to the neighboring states and others for NGOs to come and operate. That's not a situation that we can have or we should be supporting. If we have the excellence to go out and we say that, we went out, operated, why is it that we cannot provide quality services to our own people? And why do we need to say? And what is it? NPCB also represents the best partnership model that has happened between the government and the NGOs. We have partnered it out, saying there are hospitals which are struggling out. I think working in government hospitals, very often the expectation is, okay, take a government hospital, I know. But like Mr. Desi Raju said, ultimately it's the person and the public is going to come to the government hospitals only. That's your first point of contact at a primary health center in the villages or in the districts. It's after that everything else comes in. So we need to ensure that the government hospitals do not become dysfunctional, do not become examples for mediocrity or anything, that they have and have the facilities. The RIOs have been supported. They need to engender a culture of service, of quality, of trying to be a research and in the frontier areas of knowledge, that you need to build in those excellences, and that you provide the leadership and a seamless connectivity down to the medical colleges, the district hospitals, the sub-district, and to the vision centers at the primary health care center. I think those are the ones that we need. If that systems approach right from the primary health center, what are these vision centers supposed to do? That's where the question comes. Maybe we often say it's at village, okay, we just provide the refractive services and then do the referrals. Yes, maybe, but we could move a step ahead. There is also this issue of the optometric fraternity plus the ophthalmologist. How do we combine both these two? How do we build the synergies between these two? How do we build the synergies along the line from the RIOs to the vision centers? And how do we build the synergies between government hospitals and centers like Aravind, Shankara Netralaya, maybe LV Prasad? There are many, because these are institutions which are supporting. As I go out, very often one hears about the wonderful work they are doing, the trainings that they are providing. So we need to build this synergies. We need to build this process of osmosis, of give and take between all the institutions that are there, so that we are able to optimize and build a set of energies that are efficient to deliver a quality eye care within the country. These 2 days, I think there will be much interactions. They will be seeing some of the wards will be shown up, but some of the little things that none of us know. See, I love to say that we have this within the states, in some corners, in some districts, there are the hospitals which are doing very well and sing, but it's not known. But we need to project that out. We need to learn from those examples also. Government systems are not bad. They are there and they are dependent. So we cannot write it away. And those of you, all of you are partners in that. I would urge you, upon you, to please be proud of the fact that you're part of the government system. That's what service is about. That's what public health system for this country will deliver. Yes, partner, learn from the best that is there in the private sector, but you need to take your standards to that high where you will be looked upon with pride and with this thing. Be proud that you're part of the government system and be proud that you'll be able to deliver those services that everybody looks forward to. It's not that we cannot do it out, simple things. And innovation is not cost intensive at all. It's about the will to have it, to take it forward. Let us put our hands together. Let us partner with the best that is there, both inside and outside government, and build those synergies and carry this forward. I wish the deliberations of these 2 days every success, so that you'll contribute to making the NPCB program a much greater success. Thank you so much.